Okay, so we are here to debrief on our buyout program. As per usual, this is a really rough conversation. We had a lot of heartbreak this time, so we're going to try not to cry. But also, if you're depressed easily, you might not want to watch this because it's a lot of sad stories. But we do these because a lot of our supporters want to know exactly what we find and what the outcomes are. And so this is an opportunity for us to tell you guys where we are with our groups of buyout horses. So our first horse is named Mighty Mouse. He was a 25-ish year old miniature stallion. So cute. He was a little bay with patches of white on his fronts. And he was just in horrific pain. We could tell just from the way he was walking that he was walking on his joints instead of on his feet, both of his front feet. And we immediately gave him pain medication. Even with pain medication in place, his heart rate was in the upper 60s. Upper end of normal is in the upper 30s. So that's an indicator of severe discomfort. He had scars and rain rot and dental pathology and increased respiratory effort and decreased gastrointestinal sounds. And our intake form after hooves says injury, defect, angle changes, digital pulses, and all of those were circled on his form. From his carpi, his knees, all the way to his hooves, both in the front, he had severe valgus. So he was actually walking on the lateral aspect of his pastern joint instead of his feet. And he was given the last act of kindness. And Dr. Gina took radiographs post-mortem and confirmed just awful, complete luxation of both of those joints with evidence of associated fractures and severe osteoarthritis and bony proliferation. And I feel like we always try to describe those images. I hope they show you guys the actual radiographs because they're pretty awful.
The next horse that we had that was super critical was Arabella. We actually did her before we did Mighty Mouse because she was the foundering one. She was B2576 if you go and actually watch the intake footage for buyout. She was a 19-year-old Tennessee walking horse mare. She was black and beautiful. She looked like she either had just weaned a foal or maybe had just had a foal, which is horrific with the way her feet were, that somebody was still trying to breed her and have babies come off of her. But her heart rate was 88, and she had a really high respiratory rate. So like she was saying with Mighty Mouse, those are signs of distress, pain. She did get pain medicine, and if we don't say it on every case when we say they're painful, they all got pain medicine if they showed any signs of being painful. So she got Banamine, and she still had a really high respiratory rate and heart rate after that. So her pain was very, very catastrophic. She was given the last act of kindness, and we took radiographs of her feet, and her right front was the more severe one, and the distal bone or the P3 bone was almost completely gone. So she was walking on a disintegrating bone. So very, very painful, and I'm really glad she was. She was gorgeous, though, and she was very sweet despite it all.
Gotcha.
So next is Dawson, B2577. He is a 4-year-old stallion quarter horse bay. Overall, he actually looked really good. He had some ocular discharge, a little tiny spot of ventral edema, but otherwise looks pretty healthy. So we have him on our list to get castrated, see how his behavior is after that. Since he is a little bit older, we're hoping his studly behaviors will calm down. But we have hopes that he will make it to adoption, hopefully, because so far he looks good.
Yeah, he's just anemic, which is always a concern going into surgery. But our next horse was B2578. Our supporters named him Cedar. He was about 27 years old, and he was a bay. And oh my goodness, this horse. His heart rate was in the upper 60s, even with pain meds. His respiratory rate was also elevated. His whole left eyelid was pretty severely swollen, and he had about a 5-inch laceration across the top of his head that was just very, very painful. His whole left face from the ear to the eyelid was edematous and swollen. He also had cataracts in both eyes, so he probably couldn't see where he was going very well. He had a huge laceration on the front of his right hind leg above his pastern that was leaking joint fluid. So his extensor tendon sheath had been sliced into and then just left there, probably for at least a couple weeks. He had a digital pulse on his right front foot, so he was trying to overcompensate for the pain in his right hind by keeping his right front underneath him. And horses in that situation can develop what we call support limb laminitis. His elbows were swollen. He had pain on palpation of his withers, his cervical spine, his lumbar spine, and his face, and his poor penis was all really ulcerated. He also had evidence of hirsutism, so that's excessive hair growth that's very poor quality, kind of dry hair coat, and it's associated with Cushing's disease. In his case, we didn't test him for Cushing's disease. We gave him the last act of kindness. He was in really bad shape and a lot of discomfort. And he also had a lot of dental pathology.
Next is a horse named Memphis, which if anyone's a fan of me at all, that's where I'm from, is Memphis. So it's funny that I get him. B2579, if you watch the footage, is a 3.5-year-old thoroughbred gelding. He has a lip tattoo, but it's not legible, which we get a lot of here. People like burn it or try to make it so you can't read it, so you can't trace who they are, but he has a microchip, so whoop-de-doo about that. He has quite a bit of patchy hair loss over his body, so we're hoping that while he's in quarantine and getting some good support, maybe we can get him like some kind of immune support or something to kind of boost that for him. Otherwise, we would really like for him to have medicated shampoo baths, but in quarantine, it's kind of hard to do that because if you go and touch quarantine horses, you can't touch horses anywhere else on the property, so it'd have to be a big deal or somebody would just have to be dedicated to doing that. So the best thing that we can do is probably just try and support him from the inside out. He acts like somebody has not treated him very well. When you approach him, he starts kind of head shaking and like his cutaneous trunk eye muscle starts to shake like they do when they have flies drop on them because he's anticipating you touching him and it hurting. So some of those wounds, Dr. Lydia sprayed some wound spray on it, and he was not a fan of that, but we're hoping that if we can get his skin less painful and show him that people are not bad, that hopefully he'll relax and kind of come into his own.
Scary hissing sound.
Yeah.
So.
But other than that, physical exam-wise, heart, lungs, all that sounded pretty good. So it's just whether or not he'll trust people and we can get his skin under control.
Next we have Willow, B2580. She's a 30-year-old black grade mare. So she was pretty neurologic when she came and in respiratory distress, had some ventral facial edema, severe mucopurulent nasal discharge, and discharge coming from both eyes, dragging her back toes, her hind limbs. So she was given pain medication immediately. We took some swabs and some blood to do some testing, but she was given the last act of kindness just because of how bad she was with her neurologic and respiratory issues.
She was really ready to go.
Mm-hmm.
B2581, our supporter's named Cappuccino, which is a really cute name for him. He was the little dun quarter horse that came in. We aged him at 27, and his body condition score was a 1 out of 9, so he was emaciated. His heart rate was 44, which is elevated but not awful off the charts. He had a little bit of some serious nasal discharge. He really didn't want us to mess with his mouth at all. He had a very kind of painful, clamped mouth. And thankfully we can take dental radiographs instead of having to push for that. He did have cataracts in both of his eyes. And And he just kind of had general evidence of neglect across his skin and his hooves. He had pain on palpation of his back and his neck, and also his right forelimb was visibly malformed. It's unfortunate that sometimes you can just tell there's a fracture just with looking at it. So he had some pain medication, and we took some radiographs, and his carpus was badly fractured and likely had been broken for, I don't know, probably at least 2 years. He was a very sweet boy.
Next up is B2582, named Whirlgig. Thanks for giving me that one.
Are those just little things that like fall out of an oak tree? The little like...
Oh, maybe.
Oh, we just call them
suggested that name
helicopters.
wants
That's
it.
what we call them.
Helicopters.
Yeah.
But we call those whirly gigs. So maybe it's different.
And she was a 22-year-old Tennessee walking horse mare. She was a liver chestnut. Her respiratory rate was within normal limits. Her cardiovascular, or listening to her heart and lungs together, was all within normal limits. She had normal gut sounds. But she had bilateral mature, hypermature cataracts. She had a very unkempt hair coat, and she obviously had neglect and overgrowth of her hooves. We took wither rads, and she had small proliferations and chips along the top, because Dr. Lydia had noted that she might have had some pain on palpation over that area. And we took dental rads, and she had some pretty severe dental changes and compromised teeth, multiple of her cheek teeth. So based on all those things, I think she was given last act of kindness. Yeah, she had a lot of fractures and roots that were being resorbed.
She really wanted treats, but you
Yeah.
could tell, like, even with a small treat in her mouth, it hurt her even to just kind of hold it in there.
Yeah, and that's not fair to try and make them get through that.
All right. So next is Dumplin', B2583.
I love that name for him. That's cute. It's
Little-
a really good name.
5-year-old gelding mini. He has likely some congenital cataracts, bilateral
Microphthalmia.
microophthalmia.
He has little tiny eyeballs.
Okay.
Little tiny shrunken eyes that are very adorable.
He is very cute. Seems very well adjusted to the blindness. Nothing really seemed painful, and overall, he also looked pretty good. A few little changes in his blood work, so we'll keep an eye on him. But overall, he's just an adorable little blind mini. So hopefully he will also
so cute.
get to adoption, because he is real cute.
B2584 was a 29-year-old quarter horse gelding named Copper. Copper was a chestnut. He had a blaze, socks on his left and right hind legs, and some old man white hairs on his face. I also body condition scored him at a 1 out of 9, which is severely emaciated. He had almost absent gut sounds, which is always concerning in horses. Horses continuously eat, and they're hindgut fermenters, so we always expect to hear GI sounds. He was very dehydrated. He had some nasal discharge. His mouth was very painful and clamped shut. And I watched him out after intake. We throw hay, and he just was standing over there and not showing any interest in eating, despite being starving. He was quitting, he was dropping big wads of food. And when I gently tried to manipulate, I couldn't move his mandible. And so Dr. Gina took dental radiographs. And how many fractured teeth did he have? This is the one that had like 6 or 8 molars and premolars that were just, or was he the horrible hook wave mouth?
I think he's the one that had the back teeth going up into a sinus cavity.
Okay. This is where buyout weeks are super crazy, and our vet team has been busy. So we haven't looked at these forms, but he had really horrible, heartbreaking dental pathology, and he was given the last act of kindness.
B2585 was a 23-year-old mare Tennessee walking horse bay. We the polling of the names, she got named Peony, which is really cute. She had an elevated heart rate also, 66, but otherwise her heart sounded okay. She had gut sounds present in all 4 quadrants. She was extremely pushy and nervous. She had ophthalmia on her left eye, which means her eye's kind of protruding out a little bit. Scleral injection, which means the area around the eye was red and injected. She had conjunctivitis in both eyes. She had a very unkempt hair coat with scars and wounds. She had angle changes to her hooves, and she had pain on her back and neck, and especially over her withers. So we took radiographs. We also took some of her pasterns, and she had severely abnormal pastern angles, left front and right front. She had valgus, which means it goes outward. She had, I think that was swelling, lameness, fractures versus DSLD versus congenital versus injury versus other.
I think I wrote that before you took the radiographs and confirmed
that she actually had fractures that looked pretty old. So
in both pasterns. Those radiographs were also awful.
Yeah, they were pretty terrible. So because of all that and how painful she was, even with pain meds on board, the last act of kindness was given to her. She was cute.
All right. B2586 is Banyan, 28-year-old gelding. Had a grade 2 out of 6 heart murmur, possible mitral valve regurg, and seemed to have a lot of dental pain, poor quality for hair coat, hooves were overgrown, lots of pain on palpation. Yeah, had chronic diarrhea, little bit of an increased heart rate, did radiographs on teeth, withers, her legs or his legs, and between the heart murmur and the dental pain and the radiographs, it was decided to give him the last act of kindness.
I think this is the one with the really horrible withers.
Yeah.
Oh man, this was a tough call and a lot of conversation. So B2587 was a 9-year-old mare. She was gaited, so I think we called her a saddlebred. She was bay. And she was a good example of the crossover between behavioral health and mental health and physical health, because she had torn her eyelid a good while back. So her right eye couldn't close, and the big scarred part of the eyelid was rubbing on her eye, and you could tell it really hurt and bothered her. But she also was very fearful and reactive. She tried to jump out. She was trying to spin around in the chute. She tried to flip over backwards in our squeeze chute. And so we looked at her, and it was a really tough call because she was young. And what we would have tried to do in that case would be a surgical repair of the eyelid. It would have been a tough surgery because of how old it was and how much scar tissue was there. And the other option would have been to surgically remove the whole eye. But you hate to do that when the eye isn't the problem, the eyelid is the problem. But then we discussed it, and aftercare wise, she would have needed an SPL, a subpalpebral lavage, which is just a fancy word for you put a needle up above the eye and you run a little tube so you can put eye meds in the eye. She would have needed them about every 2 hours while the eyelid healed, in order to keep the eye visual. And so our team met and discussed, and what we do with these guys that are very, very fearful is we let them decompress. We turn them out, and we give them time and space, and then we gently work up to halter training them. This mare clearly had never been halter trained. But in her case, we kind of kept going, if we can't touch her not in a squeeze chute, how are we going to put eye meds in every 2 hours? And is this fair to her? And ultimately, we gave her the last act of kindness. And I think some people might not agree with that because she was a young animal with a theoretically fixable problem. But she was absolutely terrified of us, and she was painful. If someone had addressed her eyelid wound right when it happened, before all the contraction and scarring happened, probably you could have just sutured the lid back together, but that didn't happen, and so we had secondary disease. So not to go too in depth, I know sometimes people are like, you don't have to justify yourself, but I do feel like we do. We have to justify any decision that we make and make sure that we're not giving up on animals too easily, but also we have to respect the fact that some horses are absolutely communicate that they do not want anything to do with humans, and especially a human getting up and putting something in your eyeball every 2 hours for, 10 days or 2 weeks isn't feasible, and probably isn't what she would have picked. So she is out of pain now, and her eyelid is all better.
There are treatments for literally everything out there, but if the animal isn't amenable to them and they're not a good fit, then it's just going to end up worse than it was to begin with.
Well, and there's a huge difference between, can you put it under anesthesia and correct the problem and then go hands off? If you can do that, great. If you can't do that.
Some of it's also the staffing and the facility for it and the tools, just because you can do it and, put iMeds in there. Do you have the staffing that are educated and trained in how to do that properly and what to look for? And
the
so
relationship.
it's not super simple.
The relationship really matters too, not to go too in depth. I'm still talking more. A huge part of my job, I was a treatment technician overnight at the University of Georgia, and a huge part of my job was doing iMeds. And I literally, it hurts. Your eye hurts, and somebody's putting something in your eye, and like hour after hour, you're going in there because you're staggering them. And so these horses, like, you really rely on them trusting you and being like, I don't want you in my stall. You're hurting my eye again. But so many of the ones that we treated, they were super sweet and they did love people. And so not having any relationship already sets you at such a disadvantage. And now I'm done talking about that.
I think it's important to talk about that kind of stuff, though, so people understand it wasn't an easy decision. But B2588 is our 6-year-old gelding mini mule named Banjo that came in. He's a cute little bay. He's just real feisty. All of his TPR was within normal limits. Gut sounds were great. Everything on him looked pretty good. Dr. Lydia did a really great palpation and did not feel anything, so we believe he's definitely castrated, because he would definitely be obvious if he was not. He's somewhat friendly, but still apprehensive about people, so we're hoping we can kind of coax him out of that like we did with Cedar. This lady right here, she's a pro at it. Other than that, he doesn't really have any medical concerns at the moment, so just letting him ride out his quarantine and then reevaluate him at the end of it. But we're hoping he'll make it to adoption.
Oh, I get the name I can't pronounce. Cochise. So B2589 was named Cochise, 18-year-old gelding Mustang. Did have a brand, very well behaved, was pretty calm, respectful, had some delayed PLR in both eyes, a little bit of evidence of some vision impairment. He is covered in scars all over his body. His hooves are overgrown. But overall, looks pretty good. And so we have him down for a recheck on some blood work in a couple of weeks, a full eye exam to see what's going on with his vision. We'll check out his teeth since he's a little older. But right now he's just hanging out, kind of unwinding, and we'll reevaluate him in a couple of weeks.
Oh, Gem. That's very cute. So we got a bunch of very young horses in this group. Some of them already had microchips, which I don't know if we've been able to trace those anywhere, but this little filly is about a year old. She only has baby teeth, and she had some nasal discharge. She has some increased lung sounds in her cranial lungs on both left and right, but she didn't have any crackles, and her heart sounded good, no murmurs or arrhythmias. She has a very large, firm, like almost 8 inches, but cool swelling under her jaw. And her hair coat was very unkept, and she had other enlarged lymph nodes. So with that description, we worry about Streptococcus equi, which is the bacterial causative agent of strangles. It's called strangles because their faces can swell up and it's like someone strangling them. But we want to give her as much chance as we can. She does have an elevated white cell count, an elevated neutrophils, and some low platelets, some evidence of muscle wasting. So she definitely has a tough time ahead of her, but she is in a special quarantine pasture with some others of her group that had similar symptoms, so that if she does end up testing positive for the disease that we mentioned, which we took samples to double check, they will already be away from other horses in quarantine. And so it's nice to have a policy for that specific disease.
All right, so B2591 is another one of the babies that we looked at the very end. He was lovingly named Dudley. He is also a yearling colt, chestnut with a star. I think he had to be run into the chute, so it was hard to examine some of the other things like his heart and to get a good pulse and stuff.
He was a real naughty boy.
Yeah, he was very fasty. He also had slightly enlarged submandibular lymph nodes. She was able to hear his cranial portions or his dorsal portions of his lungs and slightly increased respiratory noises in those areas. He has a club hoof and his left front lameness. He's very toed out in both of his front legs. He has a left front slight lameness at a trot, and I think he was the one that also had a slight head tilt from the pole going left. He didn't palpate to have any testicles, but he's very young, so probably he'll be on our castration list. He had some changes on blood work, so we're going to monitor that and make sure that he's healthy enough for his castration. Otherwise, he seems pretty okay, so we're rooting for him to make it through to adoption.
B2592 was another one of the babies. She was named Kota. She did not look great on intake. Pretty lethargic, had some increased lung sounds, increased heart rate. Just an overall unkept appearance. Just didn't seem like she felt very good. But we were hoping that with a little bit of supportive care, she might pull through, and we wanted to check her blood work to see if there was any indication of an active infection or anything. By the time we pretty much had run her blood work and decided that she was not doing well, we had recommended the last act of kindness for her, but before we could even get up there, she had gone down on her own. So we immediately went up as soon as we were notified, and went through with that last act of kindness for her. And then unfortunately, one of the other babies had very similar signs. So we decided before that one went down on their own as well. We gave them the last act of kindness at the same time.
B2593. So this was another little filly. She was a bay roan with a big star. And she had increased cranial lung sounds. She was coughing. She had mucopurulent nasal discharge. She had an elevated respiratory effort, really poor quality hair coat. Her hind legs were, she was this way. She was really base wide with her toes out. And then her legs kind of hit each other when she walked. And then she had club hooves in both of her hind feet. I don't know if you've been watching Horse Plus videos for a long time. Is Ginger the one who? Anyway, club hooves, you can sometimes improve a little bit, but it's pretty clear that she was in really bad shape. And so, yeah, we tried to give her a chance, but just like Kota, she really decompensated overnight, and she was given the last act of kindness the day after intake.
B25-94 is a yearling colt. He is a bay. He has a really poor body condition score. All these babies are actually very, very sad. They're all like 1s and 2s. He was lovingly named Stson. It is really cute. He has nasal discharge. His TPR otherwise I think was within normal limits. What she could reach of the right heart anyway, because he was also in the squeeze chute. He has just unkept hair coat. Need to check him for castration. Other than that, hopefully with supportive care, he'll be able to come out of quarantine and into our adoption program. He has some minor changes on blood work that we're keeping an eye on, but other than that, we're hoping he can pull through with the rest of his group.
B2595 named Nugget.
Oh.
Another one of our little babies. He is a chestnut. And kind of the same thing, that whole little group of babies was very similar, just unkept. He also had enlarged submandibular lymph nodes, a little bit of an increased respiratory rate, nasal discharge. He's off in the hind end, and because of his conformation and the enlarged lymph nodes and everything else, he was a little bit worse off than the other babies that had come in. And so we did recommend the last act of kindness for him.
This is another yearling, a little filly named Nelly, which is also adorable, B2596. She's a little chestnut with a star strip snip and some socks. She also is in pretty rough shape, so we're hoping that we can get her through. She kept falling on our intake day. She does have increased lung sounds and nasal discharge and submandibular lymph node enlargement. So those are all classic signs of strangles. So this group of babies is kind of all together because they came in together. They've all been exposed. And her right hind, she was lame in her right hind, and also possibly left front as well. She has elevated white blood cells, especially neutrophils. She had some signs of anemia and some signs of dehydration. So basically the best thing we can do with these babies is aggressive supportive care, sunshine, friends, good quality nutrition, and trying to reduce their stress as much as we can. So hopefully Nelly pulls through. And that was it.
That was the last one.
Yeah. Guys, if you're driving somewhere and you see a horse with a broken leg, please call someone and don't just look the other way. Mm-hmm. Every time they come in, I'm like, I don't know how people can do it.